Hello, welcome to yet another video of Acharya Nidana Academy. In this video, we are going to learn how to identify the impact of Nidana. In the sense, the persons are showing varying kinds of effects or defects or disturbances depending upon the degree of impact of or the severity of Nidana. So, here we are going to discuss this particular impact. Before going into this particular impact, we need to know some of the concepts which we need to concretize. First and foremost, information, that is, if we know about the physics, chemistry, and biology and Ayurveda fundamentals, if these two, if these are well known, then every information mentioned in Ayurveda can be learned with deepest understanding. So, second, whenever we are going to discuss Ayurveda information, we need to look into or we need to practice the minimalism. That means one small topic we have to look into from the different angles. Say about concept of dosha in terms of anatomy, in terms of physiological function, in terms of abnormal function, in terms of therapeutic function, we can able to learn this. Even for vata, we can able to learn in this particular aspect. Structural and functional and pathological and therapeutical actions we can able to learn. If we know about it, then we can have a deepest understanding in terms of vata dosha there. Third, whenever if you want to have the strong or the deepest understanding of Roga Nidana, then we have to have a clear cut description or clear cut understanding of Kriya Sharira. If you know about the concept of Kriya Sharira well, then each and every point discussed in Roga Nidana that can be learned very well. If you know about the concepts of the Roga Nidana, that is each and every concept of Roga Nidana, then practicing Kaya Chikitsa is not at all difficult, it's very, very easy. So, the fourth aspect, whenever if you know about the learning of Ayurveda principles or any information, try to look into the patterns, identify the patterns. Patterns in the sense that is repeatedly occurring observations. If you know about that particular pattern, we can able to predict the possible outcome after one particular step. That is the significance of knowing the patterns. So, if you know about it, then pattern modification can be done and pattern creation can be done so that the restoration of health can be possible. Let me give you an example. Suppose if a person is taking sour buttermilk or curds, say for example he is taking the curds for example 300 ml every night at around 9:30 or so, then if he is continuously taking for a period of 10 or 15 days, we are knowing that every day at night time he is going to consume sour buttermilk. As per the fundamentals of Ayurveda, the sour taste is responsible for the increase of pitta dosha in the body. That's how, if we are observing the person is continuously taking the substances which is considered to be having sour taste, definitely we are going to say that the person may have pitta dosha vitiation in the body. That may show in the different body systems. So the pitta vitiation there, which is showing typical symptoms in that particular site itself. So that if we are checking one particular pattern, for example, stop the sour buttermilk for a period of another 3 or 4 days, definitely you may not get that much vitiation of pitta dosha on subsequent days. Instead, if you are consuming the substances which are having less sour taste or sweeter taste, then you may have a subsidence of pitta dosha in the body. Then fifth one, no compromise in Ayurveda fundamentals will be done while discussing about the concepts there. Sixth one, very important one, try to follow one mentor. So mentor in the sense is the person who is knowing some more information than you regarding one particular subject or one particular topic. So if you know about if you are continuously observing that particular person, you can able to think what he may be thinking in the past, what he is thinking at present, and what he may think in future. So like that you can able to predict the possible pathway whenever if you are following one particular mentor. Why I am saying this? Because nowadays millions of informations are available regarding one particular topic from multiple angles, from several thousands of people. Thousands of people are having their own opinion regarding that particular topic. For example, Ayurveda itself. So Ayurveda, so multiple people are having their own understanding. So if it is very difficult to follow if you are observing multiple people, that is the reason try to follow one particular person in Ayurveda so that you can able to predict the possible sequences, right? And whenever if you are gathering the information, so that has to be Ayurveda information has to go in the Ayurveda way itself, and Western information has to go in the Western pattern itself. So try to connect at different intervals, just like the railway tracks. If you are able to connect the two, and you can able to understand the Ayurveda information as well as Western information, based on that, if you're connecting the two at different levels, then that indicates that you are moving in the right direction, right? And the last one most very important thing, whenever if you are learning the Ayurveda, it should be learned like learning a new language. How we are going to learn the new language? That is most commonly used word we are going to use. First we are going to observe the or learn the meaning, where and all we are going to use those different words, then less frequently used words, then less frequently used words. So like that we are going to learn the new language. In that way you are going to learn Ayurveda also. So coming to the introduction of Nidana, in Ayurveda, it is being mentioned specifically in Charaka Samhita. If you look into that, more than 3000 plus Nidanas are being mentioned. In the sense, so for example, Ruksha Bhojana or consuming dry substances, consuming irritant substances, consuming incompatible substances, that is Tikshna Ahara or Viruddha Ahara, etc. etc. In you, if you consider Viruddha, nearly around 18 types of Viruddha are being mentioned in Charaka Samhita. So, like that, if you analyze the whole Charaka Samhita, 3000 plus Nidanas you are going to expect in Charaka Samhita itself. So, which is considered to be responsible for dosha vitiation in the body. Thereby, there is a possibility of disease manifestation wherein the vitiated dosha will intermingle with the tissues of the body. So coming to the further interpretation, how we are going to interpret this particular Nidana? Categorize the Nidana properly. Categorize the Nidana properly. After that, identify the impact of these Nidana in different natural orifices. So where and all the impact of the Nidana may be present. So we are going to look into in the coming sessions. One or two or more orifices may have an impact by Nidana exposure itself. So with the physics, chemistry and biology, we can able to predict the possible changes that may occur inside the body. In today's discussion, we are going to discuss about three different examples. One as a Nidana, one as an effect in the body, and third one as a therapeutic measure which may have an impact in the body. Right? Whenever if you say about the impact of Shita Guna, that is cold substance, which may have an impact on respiratory system differently, which may have a different impact on cardiovascular system, which may have another impact on digestive system, which may have a totally different impact on musculoskeletal system, urinary system and nervous system. When you think about the impact of Shita Guna in respiratory system, respiratory system in the sense, whenever the person is taking the cold air, what actually happens? The immediately there is a possibility of a dryness of the respiratory mucosa, which in turn may have an impact, that is the person may have burning sensation in the nose. Sometimes the crust formation will be observed. In that particular situation, the person may have nasal obstruction also. When there is nasal obstruction, the person will be taking the breath through the open mouth. So, in the sense, the bypassing the major functions of nose, that is warming and filtration, and the third one, that is humidification of air, that will be impaired. In the sense, there is a possibility of dryness of the mucosa that may happen even in the lower respiratory passage if the person is continuously exposed to cold air. This how the impact may be totally different when it is exposed to the nasal cavity, when it is exposed to the oral cavity. Further, the Shita Guna may also have an impact on the eyes also, that is one of the major, the natural orifice, right? When you think about cardiovascular system, when you think about the major impact, that is on the peripheral vessels, that is the person may have peripheral vasoconstriction, in a sense, the to prevent the heat loss, to prevent the from the body. So the peripheral vasoconstriction will be there. The person may feel shivering. When you think about the digestive system, the person may be taking the cold juice. In that particular situation, what actually happens is there is the dryness or the contraction of the digestive mucosa element. The mucosa of the alimentary canal may happen when it is entering into the stomach, wherein the storage of this particular cold substance may be there for a period of almost 2 hours. In the sense, there will be the reduced secretion may happen in the digestive or this mucosa of the stomach, gastric mucosa. In the sense, there will be less amount of secretion of gastric juice, which contains hydrochloric acid, which contains pepsinogen, and which contains gastric mucus. All they are going to get reduced. When this is happening, naturally the digestion of the ingested food may not happen. So that means the macromolecules which are entering into the stomach, that may remain as a macromolecules or intermediate molecules, that cannot be converted into intermediate molecules or micromolecules, which is considered to be essential for the absorption of these particular nutrients which may enter into the hepatobiliary system. That's how the person may have an impact of this, the Shita Guna in the stomach. When you consider in the small intestine, the intestinal movements, both in the small intestine and large intestine, that is going to get reduced because of the Shita Guna. The less amount of secretion may happen, and the musculature that is going to get contracted. That means the peristaltic movements, they are further going to get reduced. In that way, the person may have constipation also. When you think about musculoskeletal system, that is the muscles, we are going to have the again the contraction of the in turn, the person may have the whenever if a person starts moving, that is considered to be painful. So nervous system, the again that is responsible for the slower movement to happen even in the neurons also. Urinary system, in the sense, there will be urethral contraction, thereby the person may be having an impact on the slower movement of the urine may happen. There is a possibility even the retention of urine may be present. When you think about the other aspect, that is Apatarpana, its effect as such, when you consider tarpana means what? The word tarpana means giving nutrition. Apatarpana means the nutrition which is going to have moving away from the body. So there are certain examples that are being given here. These are different examples where the person may have apatarpana effect, excessive walking. In the sense, when the person is moving more than normal, without taking any kind of the food as such, the nutrients they are going to get depleted in the body. So in the sense, what actually happens is, initially there will be carbohydrate depletion, which will be followed by fat depletion, which will be followed by protein depletion. Along with that, there will be the depletion of even water and electrolytes also, sodium ions and potassium ions in particular. Further, sunlight. When you think about sunlight, exposure to sunlight, what actually happens? That is responsible for the peripheral vasodilatation, which in turn is responsible for excessive fluid loss from the body. When there is excessive fluid loss from the body, along with that, there will be temperature loss also will happen. And whenever there is temperature loss is going to get happen, so the body needs nutrients, which is again leading to the same way carbohydrate loss, fat loss, and protein loss. Not drinking the adequate amount of water itself, again the same aspect wherein the what do you say that the dehydration may be the possibility. Running, fasting, eating less amount of food, that is considered to be responsible for the apatarpana type of effect. In the sense, running, fasting, eating less amount of food naturally, which is resulting in the again the same way macronutrients as well as micronutrients depletion. Further, appetizers and exercise. What do you mean by appetizers and exercise? In what way exercise we can able to say? Again, in the same way, appetizers, how that is responsible for the apatarpana effect, which is responsible for the increased appetite. And in that particular situation, if a person is not taking amount of adequate amount of food in relation to that particular appetizer, that will be in the same way carbohydrate loss, fat loss, protein loss, and fluid loss and electrolyte loss may happen. In that way, we can able to analyze this particular apatarpana effect. All these are considered to be responsible for the increase of vata dosha in the body in due course of time. That means whenever apatarpana effect is happening, if you look into the if you look into the chain that is responsible for the nutrient loss in the form of carbohydrate, fat and proteins, the fluid as well as electrolyte. In that way, you can able to see the depletion. The third point as such, that is Atishuchi, how that is responsible for the increase of the Vata dosha in the body. Whenever if you say Shuchi, means it is the purification therapy, Panchakarma therapy, Vamana, Virechana, Basti, Raktamokshana, Nasya, etc. These are the Panchakarma therapy. If a person is taking more amount of this, frequently performing or the if the taking these Atishuchi, excessive purificatory therapy, what actually happens is, so the word Shuchi means the elimination of the morbid contents from the nearest root. So in the sense, that is from the alimentary canal. So in the alimentary canal, how we are going to say the movement will be happening? Whenever if you look into the disease manifestation, the disease manifestation starts from alimentary canal. From there it will be moving into intravascular compartment. From there it will be moving into interstitial compartment. From there it will be moving into intracellular compartment. So that means if the pathogens are being present in the intravascular compartment, it is comparatively easier to bring it into the alimentary canal than the pathogens which are present in the interstitial compartment or intracellular compartment. So when the pathogens are present in the interstitial compartment, it is comparatively easier to treat when the pathogens are present in the intracellular compartment. The intracellular compartment in the sense that is the environment which is present inside the cells. So interstitial compartment refers to the group of cells present in the interstitial space, and the intravascular compartment in the sense that is the fluid compartment present inside the blood vessels. That means heart, the arteries, capillaries and veins. So whenever if you say the Atishuchi in the sense the bringing the morbid dosha or pathogen from the intracellular compartment to bring it into interstitial compartment. From the interstitial compartment we are making it to come into the intravascular compartment, and from there we are going to make it into come into the alimentary canal. In case of kapha dominant diseases, these pathogens are made to come into the stomach, whereas in case of pitta dominant diseases, these pathogens are made to come into the small intestine. In case of vata dominant diseases, the morbid dosha or pathogens they are made to come into the large intestine. So here the image shows the so here this why is that of pathogens are in this direction administration, wherein this is actually considered to be emesis or vamana, and we are going to give the medicine by giving 1 day gap of the 1 day gap between the snehapana, that is the consumption of ghee, and the fermentation swedana. So wherein the inflammation will be present in the stomach itself, that is therapeutic inflammation. We are introducing it and we are going to give the medicine, that is the medicine which is responsible for the vamana. We are going to give it after giving certain amount of the fluid. Then we are going to give the medicine which is responsible for the reverse peristaltic movement, as there is pyloric antrum closure will be there. In the way, in that sense, reverse peristaltic movement will happen, thereby the person may have emesis or vamana. Wherein, in case of the virechana, what we are going to give? We are going to give the medicine when with the empty stomach. Say for example, in case of vamana, we are going to give the medicine in the early morning, whereas in case of virechana, we are going to give the medicine at around 9 o'clock. That means without taking the food. That means the medicine which will be entering into the small intestine, inducing inflammation in the small intestine. That is why whatever the pathogens are being present in the intravascular compartment, they directly move into small intestine, thereby which will be eliminated via the purgation, that is through the anal route. Wherein in case of basti, what we are going to give? We are going to make in such a way that we are going to give the medicine through the rectal route. So that means which is responsible for the inflammation to happen in the large intestine. That is the reason the pathogens or the morbid dosha which are being present in the intravascular compartment, they are coming into the large intestine, they will not move into stomach or small intestine. Thereby the elimination will of these particular morbid pathogens, they will be happening via anus itself. In this way, whenever there is more and more amount of purification is being done, what actually happens is this is being responsible for the movement of the fluid which is being present, almost 2/3 of the fluid present inside the cells, which will be coming into the interstitial compartment. From there it will be coming into the intravascular compartment. So that means which is responsible for the shrinkage of the intracellular compartment, or shrinkage of the interstitial compartment, or shrinkage of intramuscular compartment may happen when there is this discussion is we have to practice the concept of minimalism and do the brainstorming session among the mastermind group. Mastermind group in the sense having the discussion with two or more number of people who are having like-mindedness, and take one nidana and think in terms of its impact on the body in different orifices. For example, Shita Guna is having nose, oral cavity, eyes, ears, breast, anus, vagina, urethra. So you have to identify the impact of these and apply the concepts of physics, chemistry and biology in understanding the impact of nidana, and learn each and every nidana in the same fashion. That's all for today. So thank you for hearing this particular session, and what would you like to have a discussion in the coming session? Mention below. If you like this particular video, put a like button. If you like this particular video, then send this particular video to maximum number of true Ayurveda learners, so that we can make a movement out of this particular small message. Thank you.